Here as a victim or as a consumer, not as a physician. Uh, the first thing I want to say is I had a heart attack on the 2nd of January. I never saw it coming. I play squash, I play tennis, I've played cricket, I've played hockey, and I thought I would never get this one, but it came. And the other thing what they said was that, like people recognize it late. Even when I had the chest pain about a few days before, I thought I was getting a heartburn or I'd eaten something bad. So I could have come into hospital about 3 or 4 days before, and I could have been picked up without having any damage to my heart. But luckily, I chose the right day to get the heart attack, the 2nd of January. There was no traffic. I reached the hospital in 15 minutes. And once I reached the hospital, I think all of you know the Nairobi traffic. The horrors of getting a heart attack lie in getting into hospital. Because like everyone has said, time is heart muscle. If you don't get into hospital in time, the muscle is going to be damaged. So eventually, when I did decide that this thing could be a heart attack, on the 2nd of January, I went into hospital. The experience from the time I landed hospital was a very positive one. There is something what we call when you reach the door, from the door to when you get the data, when you get your ECG, when you get your blood tests and all. And then once the data is there, from the data to the decision that, like you've got a heart attack, we are going to do this to you, as everyone has alluded, that, you need to open up the artery that is clogged. And from the decision to giving the drug or giving the, if I look back now, from the time I landed in hospital, within 10 minutes, my ECG, everything was done. We found out there was a heart attack. Somebody in the hospital took a photograph with their camera, and they sent it to Dr. Gillen, who was just going for a jog in the morning. So he didn't go for the jog, obviously. He came to the hospital. And he's decided that we've got to open this artery up. And I've worked with Dr. Gillen and Dr. Otieno, and when they are doing other patients, and I always tell Dr. Otieno he's not a doctor, he's a magician. So what they did for me was, this is the place where they put in a needle and they go into the heart. And then they put the dye and they found out what was blocked. And one of my arteries was 90% blocked. Dr. Gillen just put in a stent, and within, I think from the time I landed in casualty at Aga Khan Hospital to the time the stent was put was about 45 minutes, which is, I think, a world record. Kenyans are good at world records. So after 2 hours, I was fine. So they just kept me in hospital for 2 days to relieve me some of my money, but I was fine after 2. But I was fine after 2 hours, and after 2 days I was discharged, and I had my cardiac rehab and all. So it's a very positive. As a patient, I can say that I got access to world-class care here in Nairobi. And it's not just the Aga Khan Nairobi Hospital and all who have the world-class standards. And it's not just me saying, I talked to a friend of mine who comes from New York, who's a cardiologist, and I said, look, this was done to me. Did this guy treat me properly? The guy said, even if you had come to New York, we probably might not have matched those times. So we have world-class care here available. And the second thing is, what about the cost? The cost is even comparable. You don't need to run to India. You don't need to run to South Africa. The cost is comparable to what it would be in India or in South Africa. So I think the other challenges, what Dr. Matenge and all have mentioned, there are challenges in terms of, the logistics and things like that. But the world-class care is available here for a heart attack. I'm a living proof of it.